Good afternoon. This is Dana with the American Healthcare Association. We're going to get started in about 1 minute. Thank you all who have joined. And again, we're going to get started in about 1 minute here. Good afternoon, everyone. Again, this is Dana with the American Healthcare Association and National Center for Assisted Living. We thank you so much for joining us this afternoon. We had several hundred that registered for this webinar today. Clearly a lot of interest around workforce topics, no surprise. And we're just delighted again that you're here with us. We're going to have a great conversation with some amazing speakers that I've had the opportunity to work with over the past couple of years, and hopefully share some new ideas with the group and also hear your questions, feedback, and comments as well. Before we get started, there are some housekeeping items that we wanted to share, and I'm going to turn it over to Tekla at Pathways, who is so gracious in getting a lot of the details together for this particular webinar and the logistics. So Tekla, I'll turn it over to you.
Thank you so much, Dana. Just a few housekeeping items. The handouts were sent out to everyone that had registered by about 9 o'clock Central this morning via constant contact. It would have come from Advancing Excellence. The handouts will be, and an evaluation will be sent out at the end of the webinar to everyone that attends the entire webinar. With that, once the evaluations are completed, once the deadline for those has passed, which will be noted in the constant contact email that goes out after the webinar, the certificates will be sent out in about a week. We are going to ask today if you can put any questions in the Q&A. We will be taking questions at the end. If there's any questions that we're not able to get through, we'll get those answers from the speakers, and we'll get those out to you after the webinar as well.
Excellent. All right. Thanks so much, Tekla. Again, we will be watching the Q&As, so please do post your questions there. We will aim at the end, once the presenters are done, to answer questions as they come in. Just a little bit more about Advancing Excellence. So AHCA and NCAL is part of Advancing Excellence. There are a number of groups that have come together around this, and really the group itself takes collective action to develop policy recommendations around vital issues affecting the quality of care and life for individuals receiving post-acute and long-term care services and supports, as noted here on the slide. We are doing a workforce webinar series. This is really the first one that has kicked off this series for Advancing Excellence. We wanted to focus in on some great state strategies that are currently happening to revitalize the long-term care workforce. There will be more webinars that are coming next year, so stay tuned for those details. But happy you're here to join us for the first webinar that we're doing as part of this series. All right, we're going to head to the next slide here. So a little bit about our speakers. We have Claire Enright from our California affiliate that's on, Kristen Knapp, who's with our Florida Healthcare Association, Nicole Mattson, who is with our Minnesota Care Providers Organization. We also have Slone, who's with us with the Council of State Governments, and then myself again with AHCA NCAL. I focus in on workforce-related policies for the organization, and I'll be moderating the session today. Each of these presenters are going to be saying a little bit about their backgrounds, so you have more information on them, but very knowledgeable on workforce policies and procedures, and again, some great individuals to learn some new information from today. So what are you going to be hearing about? Some of the learning outcomes. One, we're going to be learning about the different state initiatives to help address the long-term care workforce shortages. Attendees will also get a basic understanding of CNA career pathways. You'll have the opportunity to get some of your pressing questions answered on the long-term care workforce front. And then lastly, again, just the opportunity to idea share here and get some questions answered. So at this time, I want to make sure there's plenty of time for the presenters to share the information that they have and for Q&A at the end. So we're going to jump right in, and I'm going to turn it over to Claire, again, at our California affiliate, to talk about CUSP, the CNA upskilling program. Claire, thanks again for being with us today, and appreciate any background you'd like to share with the group. Turning it over to you.
Well, thank you, Dana. Hi, everyone. My name is Claire. I work for the California Association of Health Facilities doing workforce stuff, but I also am the executive director for Quality Care Health Foundation, the educational foundation for the association. I've been with the association for about 7 years now. I've been in long-term care as a nurse for over 25 years, and I've been a nurse a lot longer than that. I didn't start as a CNA because they didn't exist yet. I was a nursing assistant back in the day, and this subject is near and dear to my heart. We need CNAs in our world. We need them to be skilled. We need the best of the best taking care of our frail and elderly people. So this concept of upskilling comes from my experience in trying to retain our staff when we're on the front lines, and also working for the association as a way to provide a platform to our employers to make something really stick and be achievable. Next slide, please. So because it is a real movement, CNA upskilling, we, especially in the acute care, have long had steps for licensed nurses and for other staff members. But in the long-term care world, we have not done a particularly good job in professionalizing any nursing role. And CNAs are often viewed as a, quote, entry-level job. I beg to differ. These are the people that do the hardest backbreaking work in our world, and we really need to think of it as a gateway, maybe, to a nursing career or another career in long-term care. But we mislabel it when we relegate it to entry level and often maintain it at that level. And I think the reason that we are prone to do that is because we frequently get people in that position and they don't go anywhere except for out the door when they're done doing the gig. So we have blocked it into an entry-level position. I'm encouraging us to actually change that idea and bring staff on into the gateway position and then elevate them through that and retain a qualified workspace, so work field. So that's why we talk about culture a lot in this. Next slide, please. And the next piece is our leadership. Leadership has the responsibility to ensure that the culture is intentional and reflects the goals and objectives of the company. I know that on the very high level C-suite, this is talked about around boardrooms as a given. But drilling down to what's going on at the facility level and supporting the leadership to ensure that they actually do know what their culture is and it's the culture that they intend, especially when you've got new administrators and new DONs, they need a lot of help with this, and they need to make their own commitment to it. They need to make a commitment to it as a team, and they need whatever corporate staff they have, if they have the luxury of having a corporate staff, to also support this. Next slide. So the CNA upskilling program became a package, if you will. It was born out of the necessity to include a retention piece to a very large grant that California got to build up the CNA workforce. We received a $26 million grant. It included advertising, recruitment, training, and then they said, what are you going to do to retain? And that's when we threw the scaffolding up to build the CNA upskilling program. I will include in the chat later the link to the CNA program, which is CNAP, and then I'll also give the video link to our CUSP program. So the employer, The thing about this program is it's got to be an easy lift. We made it so that the employer can decide to do it and then not have to think about it much at all, except for the investment, emotional support investment in making sure the staff actually can carry it out. So we thought about as much of the busy work, as much as the forms and all that stuff as we possibly could. So they didn't have to, the lift doesn't have to be any bigger than it needs to be. The goal is that it's employer sponsored and recognized. This isn't a union affiliation. This isn't actually associated with the association, if you will. It is employer. And then that it's turnkey. They don't have to do any thinking. They don't have to do any development. They just have to adopt. The idea is that it's transferable. So if an employee, a CNA, gets to a level 3 and they leave downtown LA because they're transferred to San Francisco, if they find an employer that is subscribing to this CUS program, the employer will acknowledge their level and pay them at that level. Rather than when one moves from one facility to another, the CNA always ends up back at the bottom of the heap, which is very frustrating and tends to make people leave the profession when they have to make a move. We did include a registry in that the association, the Education Foundation actually has a registry of all CNAs that go through each level. So if they do move and they do need proof, they have a place to access it. The goal is to reward the employee. We want to give acknowledgement where acknowledgement is due, their length of service, the education and skill and wisdom that they've attained, and the competency they've demonstrated. So it really is about going through the work as a CNA and then getting certified and demonstrating that they actually have that micro certification, and then walking the walk when they're back out in the floor. This is what makes other CNAs want to do it. They see that somebody else got, learned a new trick and now they're out there doing it and they're getting acknowledged for it. We want that. We want people to strive to better themselves. And just as an aside, if you've had anything to do with bringing new staff on, you realize, especially when you're dealing with new grads, at about the 6-month mark, they think they got it under control. They get a little bit showboaty, and oftentimes they start getting bored because they figure they know it all now. So this is I have found that it's very important to entice people to want to move forward, to not let them think that they can get stagnant or that they know it all. So that's one reason in particular why we picked that 6-month mark. Next slide, please. So the advancement is laid out. That's a minimum of 6 months working at each level. It's standardized, nationally recognized microeducation. This is paramount importance. One, we don't want each employer to think that they have to develop an educational program. We don't want any DSD to think that they've got to take time out to teach it. And we want each employer to know if they're hiring somebody new in at a level 3, they know exactly what education they've got. They know exactly that they can trust that they have their skill competency down. That's really important. We made sure that the education was all online and it's self-paced. Each class that was offered is between 8 and 16 hours. And hopefully, as we add levels, those levels will get a little bit more in depth and take a little bit longer. But a quick student, someone that's used to the online model, somebody that has English down as a fluent language, they're going to probably be able to pass these in less than 8 hours. And then the return demonstration is obviously important. It also is what ties that online education back to the facility. It also gives the facility the potential to enrich their student just a little bit more. Next slide, please. So here are the levels, the career ladder. It's level 1 is the CNA certification, whatever the state testing is. In California, that's 160 hours of training, 60 hours of theory, and 100 of clinical. That varies from state to state. The next level at the end of 6 months is preceptor. This is a program we adopted through NAHCA, more information on that coming up, but it's a general, you think you know everything. Now let's show people that you know what you know, how to be part of a team, how to do your communication skills, how to onboard. I know CNAs oftentimes alienate the oncomers. They don't want to take the time with the training. They think it's, beneath them, or they really don't have the time. So the preceptor level brings that more, it gets them involved, it makes them more want to do it, and it gives them the tools to do the job well. Restorative nursing assistant is level 3, so this would be at the end of a year. This is a program that's been offered in a variety of different ways throughout the states, throughout a state. California happened to have adopted or developed a program that our Department of Health actually gave a star to. It was done under a grant. And we took that program and had it made into on-demand online learning so that everybody's learning the same stuff. Then the next 2 levels, level 4, A and B, is either behavioral health or dementia. Most facilities sequester these residents into separate places. So one CNA most likely would not get both, although a CNA could choose to, or an employer could choose to, as they moved an employee from one part of a building to another. California, again, has a very detailed dementia training embedded into our regular training. So this is more of an advance. So this is not just for the person dealing on the occasional dementia resident during a rehab stay. This is for the person that's taking care of the, probably behind locked doors, severely demented person. And then the behavioral health, this was adopted from the serious mental illness track that our educator does. And the reason we changed it to behavioral health is because we know most facilities are now dealing with mental illness in a transient population through their rehab doors. So this is that added training that people don't get in nursing school, frankly, as well as they should, and definitely not in CNA class. Next slide, please. So this is where we got the microeducation. Again, these are nationally acknowledged programs and educators, and we thought it was really important to include educators that everybody would recognize. So the National Association of Healthcare Assistants, NAHCA, do the preceptor course and the restorative nurse assistant course. They also train the supervisors. It's an hour class for each of those. In the restorative nurse assistant course, we encourage, although it's not mandatory, that you'd get a therapy personnel involved in the skill competency, or the nurse that runs the RNA program, just to ensure that those CNAs really have got the extra skills down. Then Healthcare Interactive, the CARES program, does the behavioral health specialty and the dementia specialty. These programs are all supported through AHCA, and that's one reason why we decided to include them in this program. My goal for down the road would be to do other levels, probably more level 4s, possibly hospice, possibly infection prevention, possibly wound care, possibly cardiac care, depending on what your facility is specialized in. And then I would love to see it feed into a LVN or RN apprenticeship program. And I think that all those things are possible. This is just as far as we've gotten, and we really want to get a solid handle on it before we advance it more. Next slide, please. So the supervisor training is pretty basic, but it is part of the program. And it's not a big lift for those supervisors. The more supervisors that are involved, frankly, in especially the preceptor program, the better the program will roll when you're in the facility, because the more eyes are working together, the more of the team knows what everybody's doing. And I'm actually a firm believer, frankly, that more licensed nurses learn about RNA as well. There's nothing better than a nurse that knows how to pick somebody off a floor, knows how to do a transfer themselves, and that's where they're going to learn how to do this. Next slide, please. So the final piece is the registry. There has to be a way to hold people all accountable to the same rules, if you will. So we have a memo of understanding that the facility signs as they come on board. They are agreeing to making the micro certification available to each employee that meets the facility criteria. I underline facility criteria because this is where each individual facility can actually, if you will, kind of change or ensure that they are only bringing into the fold the CNAs that really make the criteria that they want to embrace. So you might not have everybody that hits the 6-month mark. That might be too basic a criteria. You might want to say everybody that meets the 6-month mark and has only been out sick once, or has, no late clock ins, or doesn't rack up a bunch of overtime. Those are criteria that we've allowed for individualization per each facility. The bare minimum is that 6 months. They agree to submit the employee's microeducation certificate to the registry. This is, again, really important. It's showing that their support in the individual CNA's advancement. They agree to provide the incremental wage increase to each level attained. Again, we don't dictate what that level of wage increase is. Some facilities are already paying out in California over $22 an hour for students. So they don't see that they have a bunch of extra cash laying around. So maybe it's 5 cents, maybe it's 25 cents, maybe it's 5 cents in a really neat plaque. Who knows, but it's 5 cents an hour. Other facilities are doing more what would be considered realistic in the other parts of our profession, which is, $5 an hour, $2 an hour, etc. But that's left up to the facility. And then agreeing to pay all new hires that are listed at the registry at the level held. So if you come in to a new employer at a level 3 CNA, they're going to hire you on as a level 3 CNA. I think that's the next slide. I think that might be it there. We're done. So I'm way open for questions or any thoughts, concerns.
Great, Claire, thank you so much. Some excellent work going on in California, and we're just going to keep moving along here, and we will get to questions at the end. I know Tekla's been answering some of the logistical questions that have come in, so thanks again, Tekla, for that. So Kristen, we're going to turn it over to you now. Please share a little bit about your background as well, and over to you.
Okay, great. Thanks, Dana, and thanks, Claire. So I'm Kristen Knapp. I am the Senior Director of Strategy and Communications with the Florida Healthcare Association. I have been primarily in healthcare public relations for more than 30 years and have spent 17 years at the Florida Healthcare Association. So I manage all of our public relations initiatives, but I also focus on our leadership development programs and our workforce initiatives, including our education related to workforce, as well as our scholarship program that we have, which I'll talk a little bit about. But I wanted to just give you a quick background on Florida healthcare and the state of Florida, just to, as we dive into, some of the things that we've been focused on. So next slide, Dana. FHCA is our state's largest advocacy organization. We represent about 86% of our skilled nursing facilities. Florida is home to, actually, it's a little over 700 skilled nursing facilities, as well as over 3,300 assisted living communities. So we are the largest. We also have building business partners as well that we focus on, many of who we partner with on our workforce initiatives. And next slide. We have legislative advocacy, where you'll hear a little bit about some of the legislation related to workforce in a moment. Similar to our other state affiliates, quality improvement initiatives, regulatory guidance. We do a lot of leadership development, professional development for our members, as well as emergency prep, workforce initiatives, and then, of course, our preferred partnership programs. Next slide. So here's just some insight on Florida. We have right now we're averaging about almost 90% occupancy in our nursing centers. We are definitely a state that continues to grow in terms of folks wanting to relocate, seniors wanting to relocate here. Our baby boomer population is rising. These are just some demographics in terms of what our nursing centers are seeing and the direct care staff that we have. And I thought that was just helpful to incorporate that into the presentation so that you can see where our state legislature particularly has wanted to put an emphasis on workforce as part of the activities that they've done. So next slide, Dana. So, here's again, just some background I mentioned of, of the residents that are moving to our state and where we are in terms of, our need to fill job openings. And I will tell you in particular, we're looking at, since 2012, but even since the pandemic, our certified nursing assistant population is declining. We're not having as many people that are actually sitting to take their CNA certification exams. LPNs make up over 60% of the long-term care workforce. And in our state, the biggest challenge that we're hearing among our hospitals, other healthcare entities is the licensed nurses. There is just everyone is competing for the same population. We don't have enough educators. We don't have enough folks that are entering into the nursing school. So I'm sure the folks that are on this webinar are all feeling the same challenges in their states. And, it's just something that we're trying to address. So next slide, Dana, I'll highlight some of the things that our state legislature has focused on to try to work on this. So in 2021, we had legislation that established the personal care attendant program. This really is, I like to call it an earn while you learn initiative, if you will. Personal care attendants will undergo 16 hours of education, 8 hours of clinical training, demonstrate their competencies, and then they work alongside CNAs as well as licensed nurses to really get that hands-on training for up to 120 days in the center. And it prepares them to challenge the certified nursing assistant exam. So, it does one of two things. It definitely gives people an eye-opening experience that maybe healthcare is not the career path they thought it was going to be. And so they may choose to do something different. And many of those folks that have started out as PCAs in our care centers have moved into dietary positions and other areas. But it also helps us to grow our CNA workforce by giving people that hands-on experience so they're more comfortable when it comes to challenging the exam because they're doing more than just learning by books in a classroom setting. So the PCA program continues to be beneficial to our care centers. In 2022, the legislature established the LINE Fund, Linking Industry to Nursing Education. So this is our state colleges have an opportunity to partner with a healthcare organization, whether it's a hospital or long-term care center, for a matching fund program that to train nursing staff. So we have several of our facilities are working with their local state colleges where they're upskilling their CNAs to become LPNs. They're partnering with the college who is providing the trainers, the educators, and they're able to have their team members prepare to become licensed practical nurses right on site at the facility. And through the partnership with the LINE Fund, it helps to offset some of those costs. In 2023, we had the qualified medication aid position that was established. So again, an opportunity for CNAs to earn additional certification training and a career ladder opportunity for them to go from a CNA to a QMA position. It also helps to give those nurses, really better workforce satisfaction because they're getting back to the bedside, getting back to becoming nurses as opposed to just passing the med cart. But it gives a CNA an opportunity for growth, more experience. So it's been a great program working out for both, folks looking to expand their careers, but also for the facilities to have additional hands on the floor. And then last session, we had a couple of different things. So first, our legislature very graciously increased our Medicaid funding for our nursing centers, an 8% increase, which was significant and really gave the facilities the resources to support some of those workforce challenges. The recovery since COVID, as you all know, has been very slow and very challenging. And, this funding increase really allowed facilities to start to do things that they needed to do to retain their workforce, which is, pay increases, tuition reimbursement, things that help with competing against other healthcare settings. The other legislation that was basically sponsored by our Senate President, Senator Passidomo, was the Live Healthy legislation package. And there was several initiatives that were part of that. One of which is what's called the FRAME program, which is basically loan reimbursement, tuition reimbursement for individuals in different healthcare settings, including our nurses, can apply for tuition reimbursement. We have the Health Innovation Council. So we've got representatives on this council. They're really talking about workforce now at the local levels and coming up with ways that they can be innovative. The Mobile Act would help us have folks that are coming from outside of our state to streamline their license pathway so that they can get to work faster. And just recently this week, our state agency for healthcare administration applied for a waiver to initiate and implement this Live Healthy package. And included with that was the request was a program called the TEACH, which is similar to the Line Fund, where it enables the facilities to partner with state colleges for tuition reimbursement to train their LPNs or to train their nursing staff and other healthcare initiatives as well. There's a couple of other things that are involved in the Live Healthy package that relate to dentistry and other healthcare positions, but these particularly focus on long-term care. So seeing our legislature really have taken interest and recognize that we have a nursing shortage here in our state and we need to start doing things to be proactive about it. And, they're going to be talking about it again in the 2025 session. So we're looking at different opportunities that may become available this year as well. Next slide. So I mentioned earlier, I manage our scholarship program. So Florida Healthcare Association also felt that, our legislators is being proactive. We ourselves are going to be proactive. So we have a 501c3 foundation, and through partnerships, we've been able to increase our scholarships over this past year. So in 2024, we awarded almost $70,000 to 29 individuals. We have 3 scholarship programs. The Bruce Taylor Scholarship is for employees who are looking to become nurses. So they're rising nursing professionals. They are taking classes to go from CNA to LPN or LPN to RN. We gave out 4 scholarships at $5,000 each this past year, which really made an impact on those individuals so that they could really focus on not just working in a nursing center or an assisted living community, but also their schooling without feeling, very burdened financially. The Career Climb Scholarship program that we have is for folks that are in non-nursing careers. So maybe someone who wants to become a certified dietary manager, or we have someone who wanted to become a certified human resource specialist in her care center, therapists, getting their activities certification. So it supports those non-nursing careers. And then our Rising Long-Term Care Leader Scholarship, this supports administrators in training with pursuing their license. So that's a $1,500 scholarship, which really helps to offset those costs to sit for the NHA exam. So that was something, we'll continue to do that in the year ahead, probably at about that same level. We do fundraising for our scholarship program, but We have a lot of our members who are offering tuition reimbursement, and we've heard great feedback that this helps to supplement that, as well as, it's a good recruitment program for them to not only talk about what's available to them as an employee of that care center, but also through their association membership as well. So next slide, Dana. I wanted to just talk briefly about administrators in training, because I think we focus a lot on nursing, but we are seeing there's a tremendous need for long-term care nursing home administrators. We saw a lot of decline in licensure renewal after COVID. And so really wanting to focus on that over these last few years. So I mentioned the scholarship program. We also have a preceptor provider training program and a preceptor AIT matching program. We are working with our schools across the state of Florida to make sure that they know that when they have folks that are going through the schooling to become an administrator, they can connect with us. We have a staff member who specifically focuses on matching AITs with preceptors. We're also trying to encourage more of our administrators to become preceptors, so that expands the opportunity. So, one of the challenges that we saw not to, kind of immediately post-COVID was folks that were AITs had no opportunities to become, to do that program. Folks that were interested in becoming an AIT didn't have an opportunity, but we're seeing that growth with our matching program, and that's been very beneficial. Next slide. We also do several programs to focus on newer administrators. So we call it our NHA 101 training. We have a lot of administrators with 5 years or less experience. So this is something that we do every year at our annual conference, but also through online education that helps to train the administrators and give them more information about just all the different aspects of what it takes to work in a care center. We have mentors that talk about their experience and help get them, establish those relationships so they have someone that they can lean on as well. So that's been beneficial. And then if you'll go to the next slide, we've also got our student membership. I should have flip-flopped these. This has been beneficial for administrators in training, but we offer a student membership. But I will say the NHA 101 training has been something that we've heard a tremendous need for. One of the things, even, we have hurricanes here in Florida, so emergency preparedness is something you can read about, but until you've experienced an evacuation or sheltering your residents in place, it's not quite as easy to understand. So part of that training, they walk through their emergency management. And again, they're building those connections with each other so that they're available to lean on each other when they have questions or need information, or just, how to get through an experience such as that. Next slide, Dana. We also have a leadership development program. We have two. This is the Florida Leaders Program, which we've had over 230 of our administrators go through this over the last, we actually are getting ready. We're in year 16. We just launched that last month. But this is a leadership development program that focuses on, quality improvement. We talk about the Baldrige principles, workforce development, recruitment, retention, engagement. We talk about, how to handle difficult situations, working with, a variety of, generational leadership, people from different generations, what their interests are. So there's a lot of focus on things that these administrators can take back into their building to enhance their leadership skills. So we've done this, and we also, I didn't put a slide on this, but in addition to our Florida Leaders Program, we have an Executive Nurse Leadership Academy, and that's focused on the rising nurse leader. So these are folks that might be a future director of nursing, if you will. They're going through 2 days of similar leadership development, but also they're focusing on doing some, areas in relation to risk management, infection prevention, and other focused clinical leadership skills that really helps to give these folks the tools to become, directors of nursing in the future. Next slide, Dana. So, and then I'll just, last couple of slides I wanted to talk about, we wrapped this grant up. We had a CMS CMP grant that wrapped up last year called the Caregivers Florida Career Program. And that was really focused on recruitment, retention, advertising and educating our providers. So from there, if you go to the next slide, Dana, the goal was to recruit 3,000 CNAs. We did that through a statewide media campaign. We did digital media, paid media, earned media. We connected with CNA training schools. We connected with our technical colleges, our state colleges. We also had a retention focus, again, with employee engagement and satisfaction surveys that we made available to our participating providers. We had a little over 300 participating providers. And then we had quarterly webinars that really had a focus on, again, education, on recruitment, retention, engagement. We made job seeker provider connections through a web portal that providers signed up. Through our advertising campaigns, job seekers signed up. If they were someone who was already a CNA, we were able to connect them to job openings that were available in our providers. If they were someone interested in becoming or learning more about becoming a CNA, we talked about our personal care attendant program, and then also gave them connections to the different CNA training schools, as well as many of our care centers who have those in-house. Next slide. So again, this just kind of goes into a little bit more of what I mentioned, but these were some of the things that we made available. We have a job board, so we focus on giving our facilities the opportunity to promote and post their jobs at no cost, and then we promote that job board through our digital or advertising campaigns. And then last slide is just some partnerships that we've developed that have been really beneficial, both for some of these programs that I've talked about. Our Career Source Florida, which is basically our local workforce development boards. Many of these have incumbent worker training grants or other funding opportunities that our members can take advantage of to help with upskilling their employees. They have job fairs, they have job promotion opportunities. So we try to make sure our members are connected with them so they have an opportunity to tap into those resources. Our Florida Department of Veterans Affairs, they have connections to our veterans organizations around the state. So again, another resource in terms of potential job seekers for our folks. Again, the Florida Association of Career and Technical Colleges. These associations we partnered with because many of them have the nursing training schools, the CNA and the LPN training schools. So being able to connect those with our members has been beneficial. And then HOSA, if you're not familiar with HOSA, another great resource to tap into the young adults and really try to educate them before they are heading onto their path after high school. So we have a lot of our folks that go around the state and speak to the local HOSA clubs, participate in mock interviews, and then we sponsor their conferences. And then many of our members have provided CNA clinical sites for the schools with that, the clubs that have CNA training schools. So I think that is my last slide, Dana. So I'll be happy, since we're not doing questions now, I'll turn it over to our next speaker.
Great. Kristen, thank you so much. You can see Kristen's contact information is in there as well, and we will have contact info at the end for the speakers for the questions we might not get to today. All right, we're going to move along here to Nicole, again from our Minnesota affiliate. Nicole, I'll turn it over to you for a little bit more on your background, and looking forward to your presentation.
Thanks, Dana. So I always like to start by saying that I am a long-term care person. I work for the State Association, Care Providers of Minnesota, doing workforce and lobbying. But at my heart and my identity, I am a nursing home administrator. I've worked in long-term care for my entire career, over 30 years. And now I have the privilege to serve our members and do the things that I love. I'm very passionate about our profession, and I am that career pathway ladder climber person that we're talking about today. That's me. I started as a dietary aide, and I had many positions, and I know that my story isn't unique. So I really appreciate Claire and Kristen and their presentation and all the commitment and the work that they've done, and certainly their words have been in my ear as I've done things on behalf of our members in Minnesota. So next slide. So just to provide some context and level set regarding our employment situation here in Minnesota, We have a very low unemployment rate, one of the lowest in the nation at 3.4%, and we've got a really high labor force participation rate. So we know that that opportunity factor is pretty low. It means that really every single person's contribution at this point in time matters. We want to make sure that everybody has an opportunity to engage and work to their highest level of potential. The other factor I wanted to point out that this slide drives home is the vacancy rates for healthcare employment is one of the highest in the state. I think it's like the second or third highest. And in fact, I'm here today at our governor's workforce development board meeting, and the state agency is putting some additional focus on what they call healthcare caring professions, because it's been a little bit intractable. They set a vacancy rate of 4.7%, and healthcare is a focus area. And even with that focus, they haven't been able to get it down. So they're looking to kind of double down on their efforts in our sector. But this chart here, this is data as part of the long-term care imperative, which we're a part of, Care Providers of Minnesota, and the other state association, Leading Age Minnesota. We work together as the long-term care imperative. And this is our vacancy rate data for 2024. And you can see some slight improvement. Of course, we know that COVID recovery is in there, but 17,000 openings is significant. It's just, it's almost crazy to talk about. And I also think that that's probably not indicative of the full issue, because some employers have simply stopped hiring or contracted their availability of long-term care in their community, either by rationing on a day-to-day basis or actually laying away or delicensing beds. So we know with this deep of a crisis, there is not one solution. We need to be about multiple solutions to tap talent pools with higher levels of unemployment, to lure folks away from other professions. We have to have multiple strategies rolling at any given time. So next slide. So to that end, we created Caring Careers Start Here, which, similar to the campaign that Kristen ran, is a robust website to serve as a hub for all things related to careers in our profession. And we coupled that with a statewide recruitment media campaign. This was made possible through funding through our Department of Health that they received from the CDC. Next slide. So it was a joint initiative with our imperative partner, Leading Age, and together we engaged a professional communications firm and a website design firm. The website had already existed and was an initiative. If you've been in long-term care long enough, you know that ideas kind of recycle, and that we sometimes see them come back. And Caring Careers Start Here was an idea that was born like 10 years ago, and we had some state legislative funding that seeded that, and a website was created. It didn't really go beyond that, and we really felt like we needed to engage a professional communications firm, that we really needed to do this in a way that elevated the profession and was our voice, coming from us telling our stories, not some other entity. I think because of the state agency focus, our Department of Employment and Economic Development, they've done some initiatives focused on caring professions as well. But we really felt like we needed to drive the bus to talk to others, outsiders, about what it means to work in our profession. So we designed this really beautiful website. Well, not me personally, but the communications firm, that could be a tool for job seekers, workforce development, educators, anybody that was looking for information about our profession. And we coupled that with a promotional campaign. We hired a spokesperson. We shot some really compelling career stories, messages that would resonate with today's labor force, did a lot of social media campaign, and really worked on messaging that would be effective in this moment. I think I might have it later in my presentation, but for me personally, something that I've heard all along my career is that, oh, thank you so much, your gifts are in heaven. That doesn't cut it anymore with the new labor force. They want to know what's in it for them. They want to know why they should choose a career in long-term care. And we wanted to make it easy for them to figure out why. Next slide. So being part of the initiative, it really reminded me, and just being part of this call today, why this is such a great profession. I mean, we have so many stories to tell, so many inspirational messages, but like 3 people that you see here, Nate, he was like a newbie. He just started, but had this incredible story about what inspired him to work in long-term care. And very young, I mean, very young. But he had chosen this was going to be his profession. This is going to be what he wants to do. Gladys in the middle there, she's a nurse leader. She's an immigrant. She has, her own lived experience, but she is so passionate about mentoring new folks into the profession. She is that person that you see, at the grocery store that says, hey, do you want to come work for me? And then advancing people. She has touched so many lives at her organization and is really just, a bonus for our profession in the state of Minnesota. And Jamie, the last person there, telling her story about how she didn't know what long-term care was about. She started in housekeeping, worked in housekeeping for quite a long time, and then felt comfortable enough to make the move to nursing. I just think and these are just 3 of the stories, but we really wanted to elevate those stories of professional integrity, of what it means to work in this profession, what would compel somebody else to say, yeah, that looks like me. I can do that too. Those were the messages that we wanted to elevate. Next slide. Eric Perkins, who, if you're not from Minnesota, you're not going to know who he is, but he did the sports for one of our sports broadcasting for one of our local channels here, fairly well known. He did a great job pulling out the stories from our caregivers, which are found in that link there. I won't necessarily show it, but they're on our website as well. Caring Careers Start Here. Great job. I think he resonated with the profession because he had a parent that had a chronic disease and really recognized the value of caregivers. Next slide.
Sorry, Nicole, I'm trying to advance here and it is, there we go. We got it.
No worries. So again, we were really intentional about the messaging, about having a message that resonates with today's workforce, that isn't about selfless, rewardless work. This is really work that has meaning and value. It can provide purpose and fulfillment and offer salary, benefits, career advancement, professional development. Like, you can really come here and we're going to support you in growing in this profession. I appreciate what Claire had to say about focusing on entry-level positions, and I'll get to that later in my presentation too. But we really wanted to focus on the breadth and depth that is long-term care and what we can offer to potential job seekers and how we're going to compete and maybe do better than other professions. Next slide. I should have started out earlier also saying the money didn't really come easy. Money never comes easily, does it? But we really lobbied our health department to use these dollars in a way that was centered on job seekers and getting new people into the profession. They had other ideas, very well-intended ideas that they were going to use the money on. But we really felt like if we're going to survive, we need to not be the best kept secret. We need to tell everybody and anybody what it means to work in long-term care and get more people to join us. That was the impetus for going after these dollars. And it was effective. They did an RFP, they put a bid out, and there was multiple folks that received funding. We received the largest amount of funding in that granting round. But I think because we had such a compelling message that this was a statewide initiative, that this was going to focus on really about bringing new people into the profession, we got some additional money. I don't know when that happens. When does a state agency say, hey, we got more money for you? But that's what happened. And we were able to add a website enhancement. It's an employer matching tool. This was really about giving long-term care employers an opportunity to sell themselves, to promote themselves, tell their 5-minute elevator pitch about what it means to work for them, what sets them apart. It's meant to facilitate a connection and create kind of like that hot lead that employers can follow up with. It's not a job board, which can be confusing, but it's really about matching with an employer and creating that connection. We see in our state that we've got really small providers, we've got large corporate multi-providers, and everything in between. And not everybody has the same level of resources. And during COVID and post-pandemic, workforce development very cued in and wanted to help us. And one of the things that they said was, you know, I don't know how to find all of the long-term care availability. Do you have, is it, you know, housed in one site? I'm telling folks, hey, go Google nursing home near me. We wanted to eliminate that from the equation, to have a tool that says nursing home near you, assisted living near you. Like, this is where they are. Their on-caring careers start here. You can go here and you can get matched up with a long-term care employer in your area. And then it level sets for those employers that aren't well resourced and don't have, you know, access to a recruiter. They're literally the ED, the recruiter, you know, the director of nursing and everything in between. And it's a tool that can be used by anybody regardless of their membership affiliation. Next slide. So this is just some statistics. I am not a communications person, but I will say that I'm impressed by these numbers. We've had really good traffic. The number one goal of the website is to provide education to the public about what it means to work in long-term care. And I think we've successfully done that. Our next phase is focused on ensuring that those employer matches turn into higher conversions and that we have some way of measuring that. We're moving into this second phase where we no longer have support of a communications firm. We're taking on some of this work in-house. And I will say that it has been a huge kind of victory and joy and an ability for us to work with our essentially competitor for the good of the profession. And then that's just the QR code that takes you to the website. Next slide. So the second initiative that I wanted to talk about was the New American Talent Pool and what we're doing in that area. So again, to provide some context, I attended a conference and the Minneapolis Federal Reserve was there. They have access to statisticians and economists that have so much data. If you're like me and you geek out on a chart, this was a great presentation by Eric Garcia Luna. So in Minnesota, 10% of our overall workforce is foreign-born individuals. And we know that we already have this high labor force participation rate here. But according to the Minneapolis Federal Reserve, foreign-born individuals have an even higher labor force participation rate. So like it's a guarantee, like those folks want to work. And that is a labor force that and a talent pool that we want to connect with. And I think, let's go to the next slide. The numbers for foreign-born men, even higher. And then if you go to the next slide, the numbers for foreign-born women, this was very compelling data and one that the economists weighed in on. It's climbing, right? You can see that it is climbing, and that delta between all and foreign-born, which is the red line, like that presents an opportunity for us. We want to lean in on that trend and be there at the ready to say we've got career opportunities for you. And just that the next slide, this is super hard to read. So, and I get that, but maybe you can enlarge it. But Minnesota is the yellow arrow. And I think what was important for me in this slide was that foreign-born individuals made all of the difference in our economic recovery. So that very slight light blue that you see above the line, were it not for the contributions of foreign-born individuals, we would not be above the line. And that, you know, is a compelling message for me. And I think if you go to the next slide, just adds more basis for us engaging in this new grant-funded initiative, which is New Americans in Long-Term Care. And you can go to the next slide. So this was a grant program that was passed in 2023 in the state legislature. We had the chair of our Health and Human Services Committee in the House, State House, as one of its legislative champions. And they passed $28 million for long-term care workforce development, earmarked specifically to get new Americans into the profession. What is unique about the dollars is they went to our Department of Human Services, not our Department of Employment. But it's really doubling down to solve the long-term care workforce crisis, to acknowledge that we have an issue, that we need more people, and then to really create those viable talent pipelines to the new American communities that already exist in our state. So there are 24 different grantees. We are one of them. We are partnering with the International Institute of Minnesota, which is a community-based organization that has served immigrants and refugees for over 20 years. This is a 2-year grant. It's focused in the 7-county metro area and also in greater Minnesota. And we're really excited to work with this cohort of grantees that's mostly community-based organizations, but I want to note that 2 of those grantees are our members, are our long-term care employer members in the state. It's all about doing good work. Next slide. So ultimately, this initiative is about connections, the creation of person-centered workplaces, access to tools, dialogue, problem solving to mitigate barriers. We have it centered around a job navigator who we've given a different title. But it really is about creating that framework of supports and practices that employers can adapt to suit their individual needs. We also have some dollars in there for micro-credential and attainment to enhance retention, kind of a level up program that we'll lean into towards the end of the grant. So this serves new Americans and their children. Our component of the grant is focused on employment, so individuals do need to be work authorized. There are other entities that are engaged in work through education and training. We are going to be offering employer coaching. We want to, like I said, mitigate whatever those barriers. The premise here is diagnose and treat, and also to teach employers how to create those environments and how to access those resources that they need on an ongoing basis so that we sustain this beyond the grant period. Career progression so that we can lean into that retention piece, really about developing and fortifying relationships with communities. I think PHI National indicates that long-term care workers are comprised of probably, I think, about 24% of immigrants. And I appreciate that that is the case also in Minnesota, but we really want to be intentional about what that means for us and for our employers, and really cultivate and sustain those relationships with community. And then create referral sources so that we can connect back and forth, so that this isn't about just coming into the doors, it's also about growing with us. Sorry, Dana, next slide. So this is Asha Ali. She is our newly hired community outreach and workforce navigator. It's really centered on us. This is proof of concept, right? This is us going out with all of our members and creating these connections and doing it one workplace at a time. I think that's it.
Nicole, thanks so much. Great work on that New American Initiative and other efforts in Minnesota. Clearly, you're very passionate about this. And a great comment, too, in the chat. I was part of Caring Careers. This is from Heidi Klemek, and it was fantastic. Nicole and Perk really made us feel very comfortable. So nice comment there in the chat. And Kristen, thank you. I know some questions came in during your presentation. You answered those as well, just via the chat there. So thanks for doing that. All right. Well, we're going to move next here to Sean Slone with the Council of State Governments. Sean's group has done their own webinar series as well, too, on a variety of issues. And he actually featured these three wonderful state affiliate staffers, myself on a previous webinar. It was earlier this year now, I believe, and happy to have him on today. And Sean's going to be sharing some of the work that the Council of State Government has. So Sean, I'll turn it over to you here.
Dana, thank you so much. And hi, everybody. I'm Sean Slone. I'm a senior policy analyst in the national headquarters office of the Council of State Governments in Lexington, Kentucky. I have been at CSG for the last 18 years. For the last several years, I've led two projects that we've had on the long-term care workforce, for which we had the support of the Commonwealth Fund. I also developed the agendas for the Medicaid Policy Academies that we host in DC in the fall for state policymakers from around the country. And of course, LTSS is a big focus there as well. I am excited to be part of this webinar and to talk about what we've learned over the course of the last nearly 3 years with regards to strategies to revitalize the long-term care workforce, something that our members at the state level care a great deal about. But as we've learned, that's really only part of the story. Next slide. So early last year, CSG published the Long-Term Care Policy Guide, which was the end product of a year-long 8-state task force process for which we had the support of the Commonwealth Fund. Next slide. We then took the focus on workforce policy and spun that off into a new project, again with our friends from the Commonwealth Fund, and created a new website that highlighted many of the policy activities detailed in the policy guide. Next slide. We expanded our 8-state task force of state policymakers into a national network that also included a variety of stakeholders. And we hosted a bunch of webinars that extended into this year. Many of them are archived on the website, including our conversation last November with Dana, Claire, Kristen, and Nicole that provided perhaps the inspiration for this webinar. Next slide. These were the state strategies to revitalize the long-term care workforce that we identified and highlighted across these two projects. And most of these will come as no surprise to anyone who has worked to address these concerns in recent years. Next slide. We know that obviously increasing compensation is an important one as far as recruiting and retaining workers. Direct care in particular is difficult work, and these folks need to be adequately compensated for that work. A number of experts told us it's important to connect reimbursement and wages to quality and staffing. That is the Illinois model. They passed a nursing home rate reform measure in 2022 that tied new funding to staffing levels and improvement in key quality measures. They also created a new pay scale for CNAs based on experience. Our friends at the Moving Forward Nursing Home Quality Coalition recommended efforts to improve CNA wages and support through Medicaid incentive payment programs, or MIPS, similar to that enacted by Illinois. And addressing benefits cliffs is an important one as well. If you raise wages for CNAs or other providers and they move up a tax bracket or two as a result, maybe they'll get dumped for Medicaid or other public assistance programs that they are currently eligible for. Next slide. Our next state strategy was employment support. It's not just important to pay long-term care workers more, it's also necessary to make sure that they can afford to stay on the job as they also navigate the challenges in their own lives. So we saw a number of programs from the state level on down to the facility level in recent years aimed at providing housing, childcare, and transportation support for those in long-term care. Next slide. Enhancing training and education is critical too. Apprenticeships. We are big fans at CSG. We've had many projects in recent years through which we have spoken to the value of the registered apprenticeship model to disability employment policy and other causes. Support Your Friendly Neighborhood GWEP, Geriatric Workforce Enhancement Program. These are 42 academic institutions across 37 states that receive funding in the latest round from the Health Resources and Services Administration. And some of these, we've learned, will be working with the Moving Forward Coalition folks to develop registered apprenticeships for CNAs. You can also work to improve interagency coordination, partner on apprenticeships with a wide variety of actors, and support micro-credentialing programs. Next slide. Facilitating career advancement is the next state strategy that we highlighted. We've seen many states create new career pathways for long-term care workers. You heard Claire talk about the CNA career pathway levels in California. Kristen talked about enabling CNAs to become qualified medication aides. Next slide. One thing that we heard repeatedly from folks is that it's important to support career ladders like the CUSP that Claire talked about and career lattices, so that folks can not only move up, but move around within these professions and even shift to a different track that better suits them. Give them opportunities to have increased responsibilities, become qualified medication aides, for example. Pennsylvania was another state that enacted legislation on that this year. But we've also seen this idea of the universal aid concept employed by a number of states, allowing these folks to move freely between healthcare settings, even within the course of the same day. That kind of variety, too, may help in retaining workers. Next slide. Expanding the pipeline. This strategy is all about thinking outside the box to find workers in some perhaps unexpected places to fill those jobs in long-term care. 42 jurisdictions are currently part of the Nurse Licensure Compact. Kristen talked about a streamlined licensure pathway for out-of-state practitioners moving to Florida. We've seen some health aid programs in high schools, home health aid programs, innovation grants for successful recruitment and retention efforts, job boards and employment websites. Kristen mentioned Florida's job board, the Caring Careers Start Here program in Minnesota. We've seen some other very successful statewide and targeted marketing campaigns in places like Wisconsin. Other initiatives focus on encore employees, those folks who retire and come back to work. New Americans, Nicole talked about their efforts to bring those folks into the profession in Minnesota. And high school and college students. We've also seen states establish statewide workforce development stakeholder committees. Next slide. Data collection and monitoring is the next state strategy. Lots of things that states are deciding that they need more data on. Workforce shortages and their impacts, the sufficiency of the dementia care workforce, conditions in nursing homes, compensation, societal trends affecting recruitment and retention, the numbers of people in direct care and home care, and the effectiveness of recruitment and retention efforts among them. All of that collection of data can establish the need for policy action, quantify the efficacy of existing programs, and encourage investment in programs and policies. Next slide. And our last state strategy was supporting family caregivers. Last month was National Family Caregivers Month. The Caregiver Action Network highlighted the importance of self-recognition and self-identity. And we know that those are key factors in making sure that caregivers have access to essential supports. A lot of these folks don't necessarily see themselves as caregivers. They would say, you know, I just take care of dad as they're trying to work their full-time job. So recognizing themselves in the universe of caregivers is an important part. And we see those ideas reflected in the state examples that we uncovered. The caregiver tax credit, caregiver surveys and assessments, as well as resource guides, dementia-specific training for caregivers, respite care programs, stipends for these folks, including the perspective of family caregivers when policies are enacted, ensuring that navigators are on staff at area agencies on aging to assist family caregivers in finding resources, enhancing family leave policies, and promoting financial education and planning. Next slide. In addition to all these state strategies, the other thing that we consistently heard across these projects is another thing that can help states examine and address workforce needs is the development of a multi-sector statewide master plan on aging. And we saw that play out in many of the states that we worked with. Next slide. In February, I got the chance to escape the bitter chill of Kentucky and head to Hawaii. This is our friend, Senator Sharon Moriwaki, who was a member of our original 8-state task force in 2022. She is holding up a copy of a report titled The Long-Term Care Plan for Hawaii's Older Adults that was dated July 1988. So they have been at this for a while. She kicked off a day-long summit with policymakers and stakeholders in Honolulu. Next slide. I got the chance to present about our state strategies. Next slide. We had breakout groups to dig deep on challenges and opportunities in a number of areas. Next slide. The policymakers outlined their ambitious legislative agenda for 2024. Next slide. The next day, we participated in another event at the state capitol in which those in attendance could write their name and contact information on one of these paper flowers and add it to a representation of a Hawaiian lei to demonstrate their commitment to working on these issues going forward. Next slide. And a few weeks after that, they sent me this photo following the passage of a bill to set in motion the development of Hawaii's comprehensive long-term care master plan. Next slide. And you can read my article about those events in Honolulu on the CSU website. Next slide. Speaking of statewide master plans for aging, Pennsylvania this summer unveiled its 10-year strategic plan, which is called Aging Our Way, PA. Next slide. In June, we were invited by some friends in Bucks County to participate in a summit at the community college in Newtown. And even though this was a county-based event, it did have significant buy-in from state officials. Next slide. We worked with our friends to focus the summit around the state strategies where they thought action could be taken at a county level or where there were already significant programs established. So you see the ones highlighted here that they were most interested in. Next slide. I mentioned the buy-in from state officials. This is Jason Kavulik, the Pennsylvania Secretary of Aging, who joined us virtually. He talked about how the focus of Aging Our Way, PA is really on caregiver supports. Next slide. This is our friend Kevin Coughlin from the Wisconsin Department of Health Services. We had Kevin talk about WIS Caregiver Careers, their CNA training program, WIS Caregiver Connection, their workforce IT platform, the comprehensive and multilingual marketing campaigns that they've done in that state, and the development of the Certified Direct Care Professional designation in Wisconsin. Next slide. Pennsylvania also had a fairly ambitious 2024 legislative agenda. A couple of notable bills that were passed: HB 2200, which implements phase 2 of the Nurse Licensure Compact, and most recently SB 668, which was approved earlier this fall and with which Pennsylvania became the 35th state to establish the certified medication aid position for nursing homes. Next slide. Another interesting partnership in Pennsylvania that we ran across that could make a dent in their severe nursing shortage there. Pittsburgh charity, the Jewish Healthcare Foundation, in October was awarded a $2 million grant by the Appalachian Regional Commission to seed funding for CNA training programs that are projected to hire and upskill nearly 600 CNAs by 2027. It's a collaborative effort between Pennsylvania nursing homes and the state's Service Employees International Union. Next slide. So I think what we've tried to do is cast a wide net as we've worked to identify strategies to revitalize the long-term care workforce. State policies are still our bread and butter. We are the Council of State Governments after all. But I think especially in a field like long-term care, these challenges demand solutions that come from all levels of government and a variety of stakeholders and partners, including folks like those we've heard from on the webinar today. Next slide. You can also read more about the event in Pennsylvania in my 2-part article on the CSG website. Next slide. And you'll find much of the stuff that I talked about today in one form or another on our National Online Resource Center. Next slide. And I just wanted to leave you with this. Last month, I was out in Las Vegas for the Engaging with Aging conference. It was a week after the election. I heard a lot of disappointment, a lot of gloom and doom about what may lie ahead. We also, though, heard from Allison Barkoff, the former ACL administrator, and she had some really interesting things to say about where it might be possible to find common ground and bipartisan support in the next 4 years. And she mentioned family caregiving, elder justice, behavioral health, and Alzheimer's in particular. She talked about the possibility of seeing more stuff happening and more innovation happening at the state level in the next few years. A view that CSG members would certainly subscribe to. Alice and others also talked about the need to tell our stories about loved ones, because those can really resonate with whoever the powers that be in Washington are. And I've come to end every presentation with this photo of my parents. This picture was taken on the joyous day a couple of years ago that my sister and I were able to reunite them in the same room at a nursing home that I could walk to from my house. We know that's not always possible for many Americans. Mom and Dad were able to spend their last months together in that room. Mom passed away last July. She had frontal lobe dementia. Dad passed away last September. He had Lewy body dementia. We were immensely thankful for the care that they received in that facility. Before our parents entered the nursing home, my sister was one of those family caregivers. Since she had the most flexible schedule, she drew the short straw and got to take care of Dad for a while. My mom lost the ability to speak at a certain point. This was perhaps the ultimate irony, because my mom was a very verbal person, an English teacher, a French teacher in middle school and high school. But I have a distinct memory of the last words that I heard her speak that I could understand. I was visiting her in the hospital one day after lunch, and the nurse was in there with her, and she said to my mom, "You have a visitor. Do you know who this is?" And Mom broke into a smile and said, "That's my son." I guess I got to be good with that, right? Thanks everyone for joining the webinar today, and thank you for all you do. I think all of us welcome your questions.
Thank you so much. And thank you so much, Sean, too, for sharing your family story. Always brings a tear to my eye when I hear that. So thank you. But we do have a question in the chat for you, Sean, specifically. And thanks for those that stayed after as well here. I know we're a little past time, and Sean, appreciate you kind of speeding up your conversation here. We have so many great, so many great information points that we hit today. One question for you, Sean: what is Nursing Compact Phase 2?
That's a good question. Our National Center for Interstate Compacts is right here across the hall. I'm sure they could tell you, but I don't know the specifics of what all is involved in Phase 2.
All right, and we can follow up with further information as well, too, Joe, to your question after this. So, okay, beautiful story. Yeah, thank you so much again for that. Stephanie shared that. So any closing comments at all from our speakers today? Really appreciate your time. We covered a lot in a short period here. A lot of great things happening across the country that are, impacting our nation's residents and the great care providers that are out there serving them. So any last comments from the group at all before we close?
I just want to give a shout out to Heidi Klimek, who is on the call, or at least she was. And she was one of the caregivers that I featured, and I think in the Caring Career Start Here campaign. Sean, your story just really resonates why all of these caregivers are so amazing. Heidi had like a bachelor's degree and decided she wanted to be a nurse. Like, y'all, we are pretty cool. And I hope that we keep elevating that to the forefront, because these are the people that are making an impact.
Excellent. No, great comment, Nicole. Anybody else as well? And I tell you what, this is being recorded. Tekla, there was one quick question. How do we get our CEUs? Do you mind jumping in on that? And
I'm answering that
great.
now.
Oh, great. Thanks, Tekla.
We will be sending out evaluations and handouts to everyone that attended the webinar in its entirety. Those that complete the evaluation will get a certificate in about a week.
Excellent. All right. I see Kristen's helping answer Debbie Rowe's question that's in the chat there. Well, we again appreciate this. Stay tuned. Advancing Excellence will have further workforce webinar series as we enter into 2025. Hard to believe that we're at the end of this year. The webinar we had done with Sean was over a year ago already, Sean. I said earlier this year, so time is flying by. Anyways, thank you all. Again, great presentation, some great questions that are in the chat as well. And you have everyone's contact information. Don't be shy. Reach out if you do have questions. And looking forward to you joining in future webinars. Have a good afternoon, everyone.